so many questions on the internet about wisdom teeth, and honestly, I just don't find any proper answers. So today, I decided let me go ahead and answer most, if not all, of your questions. So if you're planning to have your wisdom teeth out, know somebody who's having wisdom teeth, or need anything or any answer regarding wisdom teeth, here we go. And to make it easier for you, all of the questions on this video and their timestamps, chapters, are going to be in the description below. So let's begin. Question number 1. What is an impacted tooth? When a tooth is unable to fully erupt in your mouth, it's said to be impacted. This is because there's just not enough room. In about 9 out of 10, 90% of people out there, they have at least one impacted wisdom tooth. Second, why are wisdom teeth called wisdom teeth? Well, wisdom teeth, or third molars, are the last teeth to develop and erupt in your mouth. They come in usually around age 16 to 21, a time of life that we call it the age of wisdom. And that's why. How serious is an impacted wisdom tooth? If left in the mouth, impacted wisdom teeth may damage your neighboring teeth, or they may become infected. Overall, the third molar area, however, is just difficult to clean. This, in turn, would invite bacteria that would lead to gum disease. Oral bacteria, then, can travel from your mouth through the bloodstream, a process we call bacteremia, leading into systemic infections. And these may affect your heart, your kidney, or other organs. Also, cysts or tumors may develop and form around these impacted wisdom teeth. The other thing, dental caries, which may develop around your second molars next to the wisdom teeth because of inability to clean in these areas properly. The other question is usually, should wisdom teeth come out if they haven't caused any problem yet? This question comes up a lot. Now, mind you, a pain-free wisdom tooth doesn't mean disease or problem-free. In fact, wisdom teeth that come in normally, meaning fully erupted, may still cause disease. Our association, that's the American Association of Oral and Maxillofacial Surgeons, strongly recommends that all young adults be evaluated by an oral and maxillofacial surgeon in order to assess the presence of third molars, their disease status, and suggest management options. These may range from removal to monitored retention. In general, wisdom teeth should be removed in the following instances: infections and/or periodontal disease, cavities that cannot be restored by your dentist, pathologies such as cysts and tumors, and/or damage to neighboring teeth. Wisdom teeth that are completely erupted and functional, painless, cavity-free, with healthy gum tissue, and disease-free may not require extraction. They do, however, require regular professional cleaning and annual checkups by your dentist and radiographs to monitor for any changes. Of course, there are costs associated with this active surveillance of these retained third molars, which will in turn likely be more expensive than the extraction of these teeth in the long term. So, can wisdom teeth cause fever? The short answer is yes. If there is infection that is associated with this wisdom tooth, it can cause fever. The other question is, can a wisdom tooth cause ear pain? Yes, because nerves that supplies the jaw and the ear are very close to wisdom teeth roots. Also, the upper wisdom teeth are very close to the maxillary sinuses. Therefore, infection and inflammation of these wisdom teeth may manifest as ear pain or jaw pain. And the same applies to headaches caused by wisdom teeth. The solution is, of course, removal of the wisdom teeth. When should wisdom teeth be extracted? The short answer is anywhere between ages 15 to 18 years old, when the roots of these teeth are 2/3 formed. Are wisdom teeth extraction painful? Of course not, especially if done under IV sedation, truly, which is my preferred method to do it. How long does it take to extract wisdom teeth? Well, if sedated, the general answer is about 30 minutes. But this really depends on a lot of factors, such as the depth of the impaction, the age of the patient, the experience of the surgeon, whether the patient is awake or sedated. So it varies, but overall, it's about 30 minutes for a set of 4 wisdom teeth. Is it necessary to have an X-ray before oral surgery? Yes, of course. I typically get a cone beam CT scan on all the wisdom teeth that are too close to the nerve, the inferior alveolar canal nerve, or the sinuses. This is, of course, to help me with the surgery and mitigate and reduce the risks associated with the surgery. So what about smoking, vaping, cannabis? Okay, let's address this big elephant in the room that most teenagers and adults are experiencing right now. Smoking and vaping constricts your blood vessels, impairing blood supply to the surgical sites. This in turn impairs proper healing of the surgical site. My advice, therefore, is 1 week of no smoking or vaping preoperatively prior to surgery, and 2 weeks following your wisdom teeth extraction surgery. You can as well quit, right? Cannabis interacts with some of the medications that we use for IV sedation. So it's therefore important that you disclose this with your oral maxillofacial surgeon prior to the procedures so they can modify their anesthetic technique. So what about GLP-1 medications? These are medications given for weight loss, and they have been very useful. Typically, these medications slows down your metabolism, which means your stomach content stays there longer. We therefore need to know if you're on these medications so we can modify your NPO status. NPO is a Latin phrase, nil per os, meaning nothing by mouth. Typically 6 to 8 hours before your surgery. So what about post-operative medications? I have a whole separate video on that, so you can watch it, just Google it. But in summary, I prefer a combination of ibuprofen and Tylenol taken together 3 times a day for the first 5 days after your wisdom teeth. What about post-operative diet? I also have a separate video on that, so you can watch it. But overall, a soft, non-chew diet for 5 to 7 days is appropriate. And by that I mean not full liquid, but rather soft, real food from day one. So what about complications in dry socket? Well, like any other surgery, complications should be considered. These are, however, very, very rare. And in good hands, following wisdom teeth extractions, I don't expect them. I'm therefore not very concerned about them. Actually, I couldn't tell you the last time I had a patient with dry socket. It's been years. All I can say is proper surgery, cleaning of the site, closing the area nicely, making sure that the patient is following instructions. This goes a long way. Now, having said this, again, there's always complications associated with any surgery. How long is the recovery after wisdom teeth removal? Typically 3 to 5 days, but there's a lot of factors. The patient's age, difficulty of the extraction, the surgeon's experience, medical issues such as diabetes, smoking, immune status of the patient, etc., etc. But overall, 3 to 5 days. Well, thank you. And I'm hoping that this information has been useful to all those who are about to have their wisdom teeth extracted. And if you have any suggestions for future topics, please leave them in the comments below, and I would gladly answer them on our next video. Thank you.